Published a scathing report on homeopathy. It concludes the NHS should stop funding homeopathic remedies because there isn't enough evidence to support their effectiveness beyond a placebo effect. Well, joining me now to discuss this story further is Dr. Charlotte Mendes de Costa. She is a GP who integrates homeopathy into her day-to-day prescriptions, and I'm also joined by David Colquhoun, a professor of pharmacology at the University College of London. Welcome to you both. Thanks very much indeed for coming in. Dr. Mendes de Costa, I'll just start by getting your reaction to this. They say they don't work and shouldn't be funded.
Well, obviously it's very disappointing. It's a sad day for homeopathy. Hopefully the government and the Department of Health won't take much notice of the report and will carry on funding homeopathy and hopefully increase funding so that there is more research and also that they'll listen to patients, what patients really want, which is they want a complementary medicine within the NHS, as has been since 1948. There have been homeopathic hospitals around since then, since the inception of the NHS.
Okay. Professor Colquhoun, should there be more funding for research into homeopathy, perhaps?
Absolutely not. It's an open and shut question. We've been going on like this for 200 years now. There's nothing in the pills. It's very, very simple.
But we've got Dr. Mendes de Costa sitting there, and her, along with 400 other health professionals, practice homeopathy alongside conventional medicine. Doesn't that say something?
Yes, it says something for the ability of human beings to go in for wishful thinking, I think, more than anything else. But the point is that people like you are not going to do too much harm. We were discussing in the green room, if you had a child with diarrhea, you give him, along with the rehydration, you give him a homeopathic pill. Now, the homeopathic pill doesn't contain anything, wouldn't do anything, but of course the rehydration would be the correct treatment. But this is not what most homeopaths do. The medical homeopaths are a very small fraction of all homeopaths. In the Society of Homeopaths, you have people who recommend their empty sugar pills for preventing malaria and cholera and things like that. This is AIDS. They had a whole conference on treatment of AIDS with empty homeopathic pills. This is very dangerous and not at all like what you would do, but it's like most quasi-religious things. It's split down the middle itself. Well, not down the middle, because there are very few like you and a great deal who are irresponsible.
So when it comes to the NHS, is it any more than wishful thinking? And given the state of the economy at the time, you know, this is the one thing, of anything, that should have its funding cut, isn't it?
Well, no, not at all. I mean, if you consider, I think last year there was £152,000 spent within the NHS on homeopathic medicines, and that would be compared with £11 billion spent on conventional medicines.
That's a waste of money, no matter how small a fraction of the budget it is. If it's not working, it's a waste, isn't it?
Well, it would be if it didn't work, but it does work.
But there's no evidence,
in my experience, it works. I see patients, I prescribe homeopathy in about 10% of my consultations. And I find that it works frequently and patients are very happy to take it. They take it when, for instance, conventional medicines don't work for them or they don't like the side effects.
Professor Colquhoun, a practising qualified doctor, saying
and we haven't even begun to speak about the research.
It is worrying, yes. But of course patients get better anyway. The sort of things that you're giving these treatments for are not serious things because you're too sensible for that.
But if patients want homeopathic medicine and they're paying their taxes, surely they should be available if it's what patients want?
They might well like Chanel No. 5 on the NHS or Voodoo on the NHS. You can't, you know, the NHS has a very limited budget. It can't fund everything that people want, and it shouldn't fund it unless there's good reason to think that it works.
So what will you do now in the light of this report?
Well, firstly, I'd just like to say that there is good evidence that it works. There are over 100 randomised controlled trials, of which at least half show positive responses for homeopathy. There are outcome trials, outcome studies. For instance, the Bristol Homeopathic Hospital looked at 6,500 patients. This was published in 2005. And over 50% found a significant improvement in their health.
We're running out of time, I'm afraid. One word reaction.
The Bristol study compared the homeopathy with nothing. It is absolutely meaningless.
We have to leave it there. A very clear disagreement then. Dr. Charlotte Mendes de Costa, thanks very much indeed, and our thanks also to you, Professor Colquhoun. Thank you.
Thank you.